Hello. Previously, my brother spoke to you about Parkinson's disease. Today, we will be discussing complex regional pain syndrome. What is complex regional pain syndrome? It is a chronic pain disorder affecting one of the limbs, arms, legs, hands, or feet. It is usually after an injury or trauma to that limb. CRPS is believed to be caused by damage to the peripheral or central nervous system. CRPS is characterized by prolonged or excessive pain and mild or dramatic changes in the skin color, temperature, and or swelling of the affected area. CRPS symptoms may vary in severity and duration. Studies of the incidence and prevalence of the disease show that most cases are mild and individuals recover gradually with time. In more severe cases, individuals may not recover and may have long-term disability. There are two similar forms called CRPS1 and CRPS2 with the same symptoms and treatments. CRPS2, previously called causalgia, is the term used for patients with confirmed nerve injuries. Individuals without confirmed nerve injury, we classify as having CRPS1, previously called reflex sympathetic dystrophy syndrome. Some research has identified evidence of nerve injury in CRPS1, so the validity of the two forms really is under investigation. History. The first descriptions of CRPS were documented during the American Civil War by a young physician named Silas Weir Mitchell. Mr. Mitchell was a young U.S. Army contract physician who treated soldiers with gunshot wounds. Mr. Mitchell wrote, "Perhaps few persons who are not physicians can realize the influence of which long-continued, unendurable pain can have on both body and mind." He described the pain, which persisted long after the bullets were removed from the bodies of soldiers. He noted that the pain was of a burning nature and called it causalgia. That is Greek for burning pain. He attributed it to the consequence of nerve injury. Silas Weir Mitchell described causalgia as the most terrible of all tortures which a nerve wound may inflict. Under such torments, the temper changes. The most amiable grow irritable. The soldier becomes a coward. The strongest man is scarcely less nervous than the most hysterical girl. Unquote. Some common names for CRPS are algodystrophy, algoneurodystrophy, peripheral trophoneurosis, morbus Sudeck,
Okay. Upon interacting with a patient with CRPS, it might be difficult for them to be in a comfortable position or find comfort at all during their treatment in physical therapy. We'll talk more about that in a bit, but first, let's go over some of the incidence and the prevalence numbers. Follow me. So who can get CRPS? Well, anyone can get CRPS. It can strike at any age and affects both men and women. However, it is more common in women. The average age of the affected individuals with CRPS is 40. However, it is very rare in the elderly. Children do not get it before the age of 5, and very rarely before the age of 10, but it is not uncommon in teenagers.
Doctors aren't sure what causes some individuals to develop CRPS, while others with similar trauma do not. In more than 90% of cases, the condition is triggered by a clear history of trauma or injury. The most common triggers are fractures, sprains or strains, soft tissue injuries such as burns, cuts, or bruises, limb immobilization such as being in a cast, or surgical or medical procedures such as needle sticks. CRPS represents an abnormal response that magnifies the effects of the injury. In this respect, it is like an allergy. Some people respond excessively to a trigger that causes no problem for other people. Peripheral nerve abnormalities found in individuals with CRPS usually involve small, unmyelinated and thinly myelinated nerve fibers or axons that carry pain messages and signals to the blood vessels. Because small fibers of the nerves communicate with blood vessels, small fiber injuries may trigger the many different symptoms of CRPS. Molecules secreted from the ends of hyperactive injured small nerve fibers are thought to contribute to the inflammation and blood vessel abnormalities. These peripheral nerve abnormalities in turn trigger abnormal neurological function in the spinal cord and brain. This leads in some cases to complex disorders of higher cortical function. Another abnormality in CRPS involves the blood vessels in the affected limb. They may dilate or leak fluid into the surrounding tissue, causing red, swollen skin. The underlying muscles and deeper tissues can become starved of oxygen and chemicals, nutrients, causing muscle and joint pain and damage. At times, the blood vessels may overconstrict, causing cold, white, bluish skin. The dilation and constriction of small blood vessels is controlled by small nerve fiber axons as well as chemical messengers in the blood. See blood right there. CRPS also affects the immune system. High levels of inflammatory chemicals, cytokines, have been found in tissues of people with CRPS. These contribute to the redness, swelling, and warmth reported by many patients. CRPS is more common in individuals with other inflammatory conditions such as asthma. Furthermore, we must discuss
Outcomes of CRPS. The outcome of CRPS varies from person to person. Almost all children and teenagers have good recovery. Some individuals, however, are left with unremitting pain and crippling, irreversible changes despite treatment. Some evidence suggests early treatment, particularly rehabilitation, is helpful in limiting the disorder, but this benefit has not yet been proven in clinical studies. More research is needed to understand the causes of CRPS, how it progresses, and the role of early interventions. In some instances, CRPS resolves itself spontaneously. However, up to 30% of those afflicted may not respond to treatment of any kind.
Diagnosis of complex regional pain syndrome is based on physical exam and your medical history. There's no single test that can definitively diagnose complex regional pain syndrome. But the following procedures may provide important clues. Bone scan. This procedure may help detect bone changes. Sympathetic nervous system tests. These tests look for disturbances in sympathetic nervous system. For example, thermography measures the skin temperature and blood flow of your affected and unaffected limbs. Other tests can measure the amount of sweat on both limbs. Dissimilar results can implicate complex regional pain syndrome. X-rays, loss of minerals from your bones, may show up on an X-ray in later stages of the disease. Magnetic resonance imaging, MRI, images captured by an MRI may show a number of tissue changes. Imaging techniques may also be used. Other procedures that may help to diagnose are bone density tests, skin temperature measurement, thermography, pseudomotor function tests.
Therapies for CRPS. Since CRPS can include symptoms caused by circulatory issues, a PT or a PTA can introduce the patient to exercises to keep the affected limb moving. We also are aware that pain can be a strong deterrent for moving normally or moving at all. So it is important to keep the area moving with exercise to maintain normal limits of strength and flexibility. So if I stand in front of a mirror like so, and I extend my left hand actually looks like my right hand in the reflection of the mirror. So when I move my left hand, it looks like my right hand is moving, but it's not. And I also don't have pain with it. This tricks the brain into thinking that I don't have pain in my right hand, even though it looks like I'm moving my right hand. Medications for CRPS. Several different classes of medications have been shown to be effective for CRPS, particularly when used in the early course of the disease. No drug is approved by the U.S. Food and Drug Administration specifically for CRPS, and no single drug or combination of drugs is guaranteed to be effective in every person. Here's a few of the drugs that are used for CRPS. They include non-steroidal anti-inflammatory drugs, corticosteroids, botulinum toxin injections, and opioids, just to list a few.